Digestive disorders generate a significant economic and healthcare burden, with annual costs in the United States exceeding $111.8 billion. Treating these conditions creates a medical paradox. Conventional oral medications must be ingested and processed by the same gastrointestinal system that is currently failing or inflamed. This direct contact often irritates the mucosal lining. Consequently, 30 to 45% of patients with chronic digestive conditions fail to adhere to their treatment because of intolerable side effects. Standard treatments also introduce secondary iatrogenic effects, medical complications caused by the treatment itself. Antibiotic-associated diarrhea affects up to 35% of patients, adding new complications to the primary pathology. To treat a severely compromised digestive system, clinicians require a pharmacological delivery route that entirely bypasses the gastrointestinal mucosa. The human umbilicus functions as a specialized transdermal delivery vector, applying medicine through the skin for systemic absorption. Here, the unusually thin epidermis sits directly above dense vascular networks and meridian connections, providing a direct conduit to facilitate gastrointestinal regulation. Dr. Qingcai Wang's 2025 retrospective case series analyzes this delivery vector through the use of condition-specific herbal pouches. The study reports that external herbal applications at the navel demonstrate rapid regulation of gastrointestinal motility. Across the diverse clinical cohort, the study recorded systemic multi-organ support, with 0 reported adverse events. The cohort included 9 patients, ranging from a 20-day-old neonate to a 76-year-old, presenting with specific digestive conditions. The protocol utilized non-adhesive herbal pouches applied for up to 24 hours daily, targeting 3 anatomical sites: the navel, the kidney area, and the right lower quadrant. The study utilized 5 distinct botanical formulas, each engineered to target the unique pathophysiology of a specific condition. Traditional Chinese medicine principles guided these formulations, specifically taste-organ correspondence and thermal properties, to restore internal balance. Because the formulations are strictly condition-specific, the clinical data must be analyzed by how effectively each targeted pouch addressed its specific pathology. In Case 1, an 11-month-old female suffered from severe post-antibiotic diarrhea, experiencing more than 6 watery stools daily with a thick white tongue coating. Within 48 hours of applying the Spleen Health pouch, stools normalized to 2 per day. Appetite and energy recovered progressively. Case 2 replicated these results in a 20-day-old male with neonatal digestive distress and abdominal distension. Utilizing a pediatric dosage of 4 hours daily, abdominal distension and excessive crying decreased by day 3, with full stool normalization by day 7. This transdermal route demonstrated an accelerated onset of action for pediatric hypermotility without the risks of microbiome disruption associated with systemic medications. The therapy also addressed hypomotility, the opposite physiological state, seen in Case 8, a 5-year-old male with chronic constipation. This patient's baseline metrics showed bowel movements only every 3 days, accompanied by straining and hard stools, scoring a type 1 to 2 on the Bristol Stool Scale. The Bristol Stool Scale is a diagnostic tool that classifies human feces into 7 categories based on shape and consistency to assess digestive health. The intervention involved a nightly chronic constipation pouch applied for 11 hours. Within 72 hours, the patient reached a 48-hour regularity cycle, with softer stools scoring a type 3 to 4 on the Bristol scale. The delivery route addressed both hyperactive and sluggish bowels within the same pediatric cohort, suggesting the intervention interacts with the body's internal regulatory systems rather than acting as a simple stimulant or suppressant. Case 7, a 34-year-old male, illustrates why the transdermal bypass is effective. His endoscopic report confirmed chronic superficial atrophic gastritis. The patient suffered a clinical paradox. Treating his diarrhea with oral medicine actually worsened symptoms as it passed through his inflamed system unabsorbed. His gastric mucosa was too compromised and inflamed to tolerate or absorb oral ingestion. After pivoting to the external chronic diarrhea pouch, the patient achieved complete resolution of diarrhea and epigastric pain within 3 days. Bypassing the gut entirely is critical for patients with severe mucosal deterioration, proving that direct mucosal contact is not a requirement for therapeutic success. These clinical results prompt a mechanistic question: how does an external pouch regulate internal organ motility? The study observed that therapeutic effects diminish as the pouch's aroma fades, identifying volatile compounds as the active agents. These compounds enter capillary beds through the skin. Simultaneously, signals travel up the vagus nerve, the autonomic nervous system's longest nerve, activating the gut-brain axis. The gut-brain axis is the bidirectional communication network connecting the central nervous system to the enteric nervous system of the digestive tract. These concurrent pathways modulate the gut microbiota to reset intestinal motility. The navel serves as a biological router, converting external volatile inputs into systemic neurological and gastrointestinal responses. This study has strict clinical limitations. As a retrospective case series of 9 patients, it lacks control groups and relies on subjective reporting. This design cannot definitively prove causality or rule out the natural resolution of symptoms over time. Moving forward requires large-scale randomized controlled trials with at least 50 patients per arm, using validated tools like the IBS-SSS. IBS-SSS stands for the Irritable Bowel Syndrome Severity Scoring System, a questionnaire used to measure the intensity of patient symptoms. Future research must incorporate objective biomarkers and microbiota sequencing to provide data beyond subjective pain and stool metrics. While preliminary, this transdermal approach offers a non-invasive frontier for patients with limited conventional options. Transforming these observations into a standard of care requires rigorous biomedical validation.